The fact that I was both a sleep technician, did sleep research, and I was a clinician at major hospitals as their primary sleep psychologist makes me unique to be able to treat people for insomnia, anxiety, trauma, addiction, and I have a depth and breadth of my background, and this really helps me to dial in a individualized program for you so that you have sound sleep. When people come in and they have insomnia, depression is a very common thing that they may be experiencing as well. So they go hand in hand. So we're not just treating insomnia, we're also treating depression. My patients tell me after they've completed treatment, their quality of life is much better, that they feel more energized, they're more socially connected, they have better relationships, they have more energy at work, they're not coming to work late like they did or being burned out on work, they're just more engaged. So there's a lot of benefits of cognitive behavioral therapy for insomnia where it improves people's overall emotional well-being and physical well-being. When we lose a loved one and we're grieving, we've experienced a very intense loss, it's very normal to have insomnia. We never completely get over a loved one that we really are deeply connected with. But there are ways to have less intense depression or sadness, grieving or loss. So I don't just help them fall back to sleep, I also help them get through the grief and loss. So I really want to help people get back into their normal life and so that they're healing from the loss. When people have experienced trauma, whether they'd been sexually or physically abused or had been in a war venue, then these kinds of things can affect sleep quality as well. It may lead to nightmares, it may lead to sleep disruption, of flashbacks coming into their mind, or just thoughts about the abuse. So I treat someone to help them overcome the trauma, start to integrate the experience more, and have a different perspective. So there are other medical conditions that affect insomnia. Sometimes people have hyperthyroid, which is that their thyroid is too active, and that leads to difficulties initiating sleep and anxiety. Others might have hypothyroid, and hypothyroid is too little, and that leads to depression. So that might lead to more awakenings throughout the night or more early morning awakenings.